Hello, everyone, and welcome to the Happiness Journey with Dr. Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual neurolinguistic programming and cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one session in English and in French, and also do group settings. If you need any assistance, reach out to DMV Therapy and Coaching Services at 301-325-1550, and our website can be found at lifecoachdanamzalai.com. Today, I'm very excited to have for our 9th episode of season 17, a very special guest and author of Nation in Pain, Judy Foreman. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Judy, the floor is yours.
Thank you. Okay, my name is Judy Foreman, and if you're trying to look me up, that's Foreman, and I have a website you can go to. I am a journalist and have been for a number of years, and I have written 5 books, in addition to probably thousands of newspaper stories and columns. I was the health columnist for many years for the Boston Globe and a science writer there. My first book, and it's still one of my favorites, is called A Nation in Pain. And there's also a sequel to that, a paperback about chronic pain around the world. And so I'm happy to talk about the opioid epidemic. I'm even more eager to talk about the chronic pain epidemic, because that gets lost amidst all the publicity about the opioid epidemic. Both are real and both are important. And my sympathies, of course, are with people who overdose from opioids, but also from chronic pain patients who can't get the opioids that they need to maintain their lives. So it's kind of it's a more nuanced message than a lot of people want to hear, but the nuance is the truth. So you can start asking me questions if you want.
Yes, well, first, Judy, thank you for taking the time to be able to meet me today and be a part of our podcast. Again, this is really a very sensitive topic because I think just recently the government put a stop in, or asking all physicians to stop prescribing opioids to their patient because of the abuse that was happening in the past, where people were overdosing, or they were just, for any kind of pain, they were trying to get prescription for it. So now, post-pandemic, how do people manage their pain? What do physicians recommend them to do?
Okay, well, I'm not sure it has anything to do with the COVID pandemic. This has been a problem before and now and during and now after, if we are truly after. I think we should back up a little bit and get a broader picture. One of the big problems that I see, the latest figures that I know of, and they may have changed a bit, is that there are 100 million Americans suffering with chronic pain. Not all of them are in severe, totally life-wrecking pain, but a number are. And for the record, there are a number of treatments that do not involve medications, which people should obviously use: acupuncture, meditation, support groups, things like that. Don't discount those. Those can help whether you are on medication or not. So that is very important. But the thing that really bothers me is that pain as a biological phenomenon is not taught as much as it should be in medical schools. One of the studies I quote in my book shows that veterinary students get more education about pain than human medical students, people who are going to take care of people. So, I mean, only half joking, you might say, if you're in pain, go to the vet, not the doctor. I mean, that's a joke. Don't take it seriously. But the point I'm making is that doctors are not educated sufficiently about pain. And it's a complicated thing. Genetics plays in. The way the body changes acute pain into chronic pain is an elaborate process. The way opioids work and don't work is an elaborate process. So it's really complicated. And one of the things that makes it even more complicated is that there's a lot of prejudice about people with pain, including from doctors and even female doctors who you might think might be more sympathetic, but doctors in general tend to dismiss women's pain more than men's pain, even though women actually statistically get more pain. There's many different kinds of pain. There's pain from inflammation. There's pain from nerve damage. It's a complex thing, and doctors don't really understand it as well as they should. The government has been terrible in trying to regulate opioids. For a long time, a couple decades ago, people were scared to give opioids, even to patients dying of cancer who were in tremendous pain. So there was a move by some doctors to increase the use of opioids, which helped people who were dying in pain. But that the pendulum has now swung way the other way. And some doctors, it is true, were prescribing too many opioids, but everybody got scared. And the government, the Centers for Disease Control, the FDA, everybody cracked down on doctors. But the net effect of that for chronic pain patients has been terrible, because they go from pharmacy to pharmacy trying to get the opioids that really they are not abusing and that really do help them. So it's really a complex thing. You know, who are the pain patients are seen as addicts. If they go to the emergency room with pain, they are assumed to be drug seeking, even when they are not addicts. So it's very complicated, and addicts themselves are suffering too. A lot of people end up with chronic pain and turn to opioids, and then some do become addicted. There's a difference between addiction and dependence. People with diabetes are dependent on insulin, and nobody criticizes them. But people with pain who are dependent on opioids can manage their lives in many cases very well, and not addicted. They don't have addictive behaviors like taking too many or overdosing on, to get high. So it's really a complicated situation, and I think not many doctors appreciate what it's like for chronic pain patients who need the opioid drugs and who can't get them. The suicide rate for people with chronic pain is twice that for people without chronic pain. That people die and kill themselves because of the chronic pain if they can't get the treatment they need. So I'll stop there for a moment and let you ask questions.
But then the one that are addicted or dependent on it, when they don't get the opioid, they go through the withdrawal effect. But this
Right.
effect is very temporary. After they summon, or after they get out of that zone, they could actually resume their life and feel better without having to always need to take opioids or pain medication when the low pain comes in. So I think this is a temporary, but those who actually are actually suffering and from either the pain because of cancer, whatever it is, this is a genuine pain. So is there a way or a program that the government or the doctors can differentiate between what is genuine pain and what is addiction?
Well, pain and addiction are two different things. Addiction means you do behaviors like getting drugs on the street, and taking the drugs even when you know they're harmful to you. That's different from reliably, responsibly being dependent on opioids to control your pain, not upping your doses, not essentially committing crimes or doing bad things to get the correct dose. So addiction and dependence are different. And then there's pain per se. And there's different types of pain, as I was saying. And opioids don't work for all kinds of pain. Some things they really do help with, like cancer pain. Some things they don't help with. So it's addiction and pain often go together, but they don't necessarily have to go together, is what I'm trying to say. There are a number of pain support groups. There's the American Chronic Pain Association. People can look up. And a lot of the people in the chronic pain support community advocate taking a multi-pronged approach and getting access to the opioids when you need them, but also using some of these other techniques, including non-medication as a help when you can. I'm
Is
not sure that answered your question.
No, it did definitely, Judy. But is there, and this is what a lot of people would like to hear, is there a holistic approach to pain beside meditation or exercise and all? Is there something else like herbs or plants that could actually alleviate certain pains?
Marijuana is very helpful for a lot of kinds of pain. I remember talking to one person with chronic, no, it was trigeminal neuralgia, a facial pain. And she said when she took marijuana, she knew that the physical sensation of pain was still there, but the emotional reaction to the pain was much less intense, so she could tolerate it more. And meditation may do the same thing, that the physical sensation of pain you're still aware of, but your emotional identification with it and tangled upness with it can be a little more manageable. So yes, that is possible. Other herbs, I don't know. I'm a little skeptical. I mean, because people, some of the herbal medicine community is so hostile to the Western medicine community that it's more of a philosophy system than a medical
That's
answer.
they're not
Uh,
back.
so I don't want people to just go off in woo-woo land
Yes.
because that's sort of like saying their pain isn't real.
Okay.
That said, placebos can help with pain too. In terms of really telling who's in pain and not, that's one of the big problems with pain because there's no blood test for pain. There's no x-ray for pain. There's no documentation that doctors can say, oh yeah, you're not lying. You're one of the good guys. You really do have pain. There's no test like that. What there is increasingly in research labs is brain scan techniques like magnetic resonance imaging.
All right.
And certain parts of the brain do light up when a person is in pain. And there have been some interesting studies when people are trying to control their pain and be less reactive to it. That also shows up on the MRIs. So you can see when a person is getting a little distance on the pain, which is interesting because that shows you have some control. But I don't want to leave people with the impression that it's all in your head because it's not.
I see. And now we see a very common, I would say, issue with many people that suffers from fibromyalgia. And
Mhm.
fibromyalgia is a very common thing that doctors, when they cannot diagnose the issue properly, they just jump and say you have got fibromyalgia. But the thing is that and you make a very good point about the brain stimulating a certain hormone if let's say you are in actual pain, because the brain have to find some defense mechanism to be able to either relay the pain somewhere else or find a way to be able to fix it or to be able to cure it. So the brain will be stimulated at this point, and they could check if this person is actually suffering from a pain genuinely or actually acting up or saying I just need pain medication, because deep inside they are addicted to the pain medication. So are they doing any advancement on those kind of research as of now, or they have not really really pinpointed how the brain reacts to pain?
I still think you're conflating addiction and pain because they are two separate things, really, even though people take potentially addicting drugs to control their pain. The research on pain, especially with imaging and magnetic resonance imaging, is fascinating, and it does show pain centers in the brain light up, and the emotional reaction to pain lights up the limbic system. And people can somewhat learn to use meditation or cognitive restructuring to mitigate it somewhat. But the physical mechanism, the physical biology, the nerve signals saying that a person is in pain are still there. In fact, interestingly, when people are feeling very empathic, if you're feeling very empathic to your wife in pain, some of those same centers will light up in your brain. So it's very tricky. The pathways of addiction are separate. I mean, I think we have to make sure that we don't conflate those two things.
So there's actually a say, I'm not sure if it's true or not, Judy. Maybe you could actually confirm it. They call it pregnancy pain, where the wife is in pain and the husband will feel. I'm not sure if it's because they're connected in a spiritual level, but they feel what the wife is feeling. Is this something similar to what you're talking about right now?
I don't know. You make me laugh. If I were the wife, I would say, yeah, right.
So, but can someone who is a caregiver to someone who's experiencing pain, can they somewhat spiritually experience something similar?
Yes, in fact, there's some people they call extreme empaths,
Okay.
people who have extreme empathy, and they really do, like Bill Clinton, feel your pain.
Yeah.
But, um, but I would argue it's probably not quite as bad as the person really feeling the pain.
Yes, correct. So what is your thoughts about what's going to happen in the next few years on how will our government, if they can eventually do that, manage the pain in our country or all those who are suffering from pain?
Boy, I wish I felt more optimistic because there's so much prejudice against people with pain. And the government has not done a good job. I mean, they haven't even, we're only recently getting medical marijuana, and that's been a battle for decades because of all the prejudice against that. And marijuana is a relatively safe drug compared to the other drugs and can help. It's not a miracle cure, but we've criminalized some of these drugs, and we've criminalized the opioids too. And at the same time, the Sackler family that made OxyContin, that they were, unscrupulous. So it's a really complicated picture. And the people who get lost in the shuffle are the people, the addicts who get trashed and stigmatized, and the people with pain who get trashed.
Mhm.
And it's really a tough battle. I wish there were simpler answers I could give you.
So are they now prescribing marijuana for outside of those who are suffering from glaucoma, and they're prescribing it for any type of pain, or is it primarily for specific pain that the doctor can confirm?
Um, I'm not sure. I have spoken with a doctor in Massachusetts, where I live, who is an expert in marijuana for all different kinds of pain, including pain from Parkinson's disease and other problems. I don't think there's a limit on what particular condition he or someone else, other doctor, could prescribe marijuana for. Taking it carefully, not overdosing, not mixing it with alcohol. I mean, I think there's a lot of good research going on and a lot of good experimentation with marijuana. I wish there were more objective, careful studies of opioids. Some of the studies show that those drugs are not as addictive as people fear, and other studies show they are. And people, as I said earlier, do confuse addiction and dependence. Many pain patients can take Vicodin or something for years without abusing it. So it's a tough one. It's a tough one.
So when it comes to hospital, which is in a controlled environment, they could give to the patient Percocet or Vicodin or whatever it is. But when it's outside of the environment of a hospital, and when it's someone who's having those medication at home, this is where the problem can start, which is any type of pain, they're going to start popping those pills like M&M, and then they're going to start just feeling or gaining more and more of this addiction that they don't want to be able to get. So then again, it creates an external environment that they have no control over, and this is why they try to avoid this kind of issue further on.
Well, that leads me to an interesting point. People have surgery all the time, every day in this country. I would say probably millions of operations. Most people get opioids to control that pain right after surgery, and most of them get off just fine and never become addicted.
Correct.
So, and without that pain control, like after surgery in the hospital, that's when acute pain, if it's not treated, can turn into chronic pain. So those opioids are being used safely all the time in hospitals,
Okay.
Which is a point to remember. But as you say, it's when people start using them on their own, getting them illegally, And what you haven't asked about yet is the whole problem with fentanyl, which is a massive problem. And I'm not an expert on this because I haven't been writing about it lately, but some of the ingredients for fentanyl, I believe, come from China and are put together in Mexico. So the drug cartels are definitely involved with this. And, we tend to blame the individual patient for, abusing drugs. But really, China has not been a good actor in this, and the drug cartels in Mexico. So there are people who are doing evil here, and it's not the patients per se. We sort of tend to blame the patients, but these cartels are shipping it in here, and people are getting overdose, very strong doses, and they don't know. When you get something on the street, you do not know what's in that.
Yes, you are so right.
You do not know. You cannot know.
That's so true. But then would you say that our society has basically became more and more ignorant, Judy? The reason, let me tell you more details, is because when you look at someone who's morbidly overweight, the only thing that you look at them is saying they don't have control in what they're eating, or they're eating the wrong food. So we have to blame them for becoming who they became in terms of physical attributes. The same thing for addiction of medication or addiction of